We're bringing the case because we think that not only is the payment mechanism in the Accountable Care Organisation contract unlawful under current NHS legislation, and that is an appalling thing for the government to be doing, to be trying to railroad things through that aren't even lawful in terms of the legislation it itself has passed. But we think it's going to end the NHS as a comprehensive health service for everyone based on clinical needs. The essence of our argument is really simple. They're replacing the current NHS contract with a contract that's based on the USA's Medicare-Medicaid system. And you probably know that Medicare and Medicaid is a very limited range of healthcare that's state-funded, and it's for people who are too poor or too old to pay for private health insurance. We don't want an NHS that's based on an insurance-based system copied from the USA. We want to keep the NHS as a comprehensive health service for everyone, where people get treatment based on their clinical need for it. If this contract comes in, that will be replaced with treatment based on financial considerations. In the States and in Spain, where this form of contract has already operated, there's a history of cherry-picking patients. So the patients who get the treatments are those whose treatment is cheap and those whose prognosis offers a good return on spending. We don't want that. If it happens, elective care like eyes, hips, knees, all those things that are so very important for people will be highly restricted, and a lot of people will be denied care and be forced to go private if they've got the money and to go without if they don't. So that's why we're bringing the case. It's really important to say that although we're challenging this through the legal system, it's absolutely vital to challenge it on the ground through local political processes. In West Yorkshire and Humberside, the Sustainability and Transformation Partnership is in talks with NHS England and NHS Improvement about becoming part of the second wave of integrated care systems. They used to be called accountable care systems, but if it walks like a duck and it quacks like a duck, it's a duck. So meet accountable care duck. Not only is this happening at the West Yorkshire and Harrogate regional level, it's happening in every local authority area. Councils are working with local clinical commissioning groups to set up local integrated care systems. And I was at the Calderdale Health and Wellbeing Board meeting on Thursday when they were giving an update on this. And it's very clear, after 2 days' research trying to unpick the jargon that they cloak everything in to conceal what they're actually doing, that what they are doing is that they're introducing exactly the kind of contract that we're challenging in court on Tuesday week. And they're overturning the current setup for primary care and community care because they say it's based on a dependency model. Think about what that means if they're calling NHS and social care something that encourages dependency. It seems to me that they're replacing it with a Lazarus model of healthcare, which is telling everyone to take up their beds and walk. Well, that isn't on. People who need care must get health care. And it's not. And the system that they're introducing is going to totally dismantle the current system of GP, primary and community care, which we can all access locally. They're going to be centralised, it's going to be, they call it GP at scale. A lot of it's going to be delivered by voluntary organisations, not trained clinicians. So for all these reasons, this is why we're taking NHS England and NHS Improvement to court. And Calderdale Clinical Commissioning Group has come in as an interested party with NHS England and NHS Improvement. So please come to the rally, show support for justice for the NHS and demand that we retain an NHS that's comprehensive, free for use for everyone who has a clinical need. It's the 70th birthday coming up. We want the NHS restored to public ownership, management, funding and provision so that the NHS can go on for at least another 70 years. Thank you very much.